Good evening. This is Dr. Shiraz Farooq and Sydney Farooq.
Hi, good evening. Welcome. Thanks for joining us today for another episode of DaBootyDoc Talk.
Hey guys, we are here from Tampa, Florida at Colorado, America at DaBootyDoc Talk. This is Dr. Shiraz Farooq, board certified colorectal surgeon, and my spouse, Sydney Farooq. We are here talking today about the 18th topic in our list, which is stress and what it does to colorectal cancer.
You might hear a little thunder and lightning. Sorry, we just lost some power there almost too. So
stress and colorectal health. This is the topic for the day. What does stress do to your colon and gut?
Well, it does a lot of the same things it does to your body and your mind, right?
Correct. This is an interesting topic because this is very common. Everybody has some idea of what goes around, but we thought we'll touch back on it and give you guys some details and maybe make you understand a little bit about the digestive system.
Yes, so if you haven't joined us before, our discussions here are based on just educational information, not meant to provide you any medical advice per se, but coming from a doctor's perspective on a very conversational basis and with a little humor involved too.
Yes, our singular goal is to make you laugh somehow, okay? If that's going to make you cry first and then laugh, or make you laugh first and then cry, that's okay too.
It depends, as long as we get there.
Yeah, humor and laughter is the best medicine. So of everything we practice, if we can tickle somebody into laughter, they're going to get healthier.
That's right. So today we'll dive in. We want to talk specifically about how stress affects your colon health.
So stress, everybody talks about it. I'm so stressed out. What does that mean? Do you know what that means?
Well, what is stress? Is it something tangible?
It can be tangible. Stress is a combination of chemistry and biology and physiology. So what happens in your body is that we are made of chemicals, and these chemicals, when they become abnormal, cause a reaction in the muscles and cause a reaction in the rest of the systems, and that causes problems. So if your hormones and your chemicals are abnormal, that's an imbalance, and that causes your muscles, your heart, your limbs, your back, your neck, your digestive system, your breathing system, your kidneys, everything else to become not so functional. And that is a stressful physiologic response.
Stress, how is it being affected then?
So I think what's happening right now is that I'm seeing that the connection is lost. So
No, I don't think so. We came back.
We came back. Okay, we are.
Sorry, I was trying to warn you guys. We're having a pretty bad thunderstorm right now. So
in Tampa, Florida, the weather is today very, very
summertime in Tampa.
And we have a lot of rain and thunder.
So bear with us. It's causing stress. I don't know what to do.
Right around in the map down there, you can see the blue area.
Ta-da! I don't know. The sun's out in this picture.
Yes,
So anyway, we're back on topic. So basically, you feel it. You know, when you're stressed out, you start getting your heart rate raised. Maybe you shake a little bit on the inside.
You may sweat.
You might tensen up your muscles.
You may breathe more or breathe less. You may have abdominal distension. You may have heartburn-like symptoms. You may choke. You may pass out. You may get antsy.
You might start popping a couple pills.
You may scream, you may cry, you may become extremely silent, you may have diarrhea, or you may feel bloated, you may pass out, you may urinate. I mean, all these things can happen in a stressful, fearful situation. So this is a chemical reaction where the hormones in your body, namely cortisol and adrenaline, these chemicals are increased, and when they are increased, they cause various other chain reactions. So your heart rate goes up, your vascular tone goes up, your blood pressure goes up, you may sweat, you may feel numb, you may feel like a heartburn problem. All of those things can happen with stressful situations. So that is some kind of a definition we've come up with what stress is and what it does to your body.
So then related specifically to the colon and your digestive system, how is stress responding in that?
So I think of the digestive system as the second brain of the body. So when we talk about the neurons and what's going on inside our brains, we know that everybody's heard the word nerves and neurons. And these are cells that communicate via electric current or with chemicals that are released. We now know that the digestive system from the mouth to the anus, this tube that we have inside us, also is lined with neurons. And this is as many neurons are as present in the brain. And that's why we have coined the word hashtag it's a gut feeling.
That's right. Oh, I wore the wrong shirt today.
No, you wore the DaBootyDoc shirt.
Yeah, so have you heard like you are what you eat?
Correct.
Or the gut-brain connection?
So this is a bidirectional connection, meaning that the brain talks to the gut or the colon or the digestive system, and the digestive system then talks back to the brain. So there's a two-way channeling going on all the time. And this is done via various nerves in the body, and the vagus nerve is the biggest one that we know about that transmits signals from the brain to the digestive system and back.
Where's the vagus nerve located?
Vagus nerve comes from the brain inside and then goes around the neck, around the heart, goes inside the digestive system, all the way down to the bottom.
So there's literally a direct connection between your mind and your gut.
And that is called the gut-brain axis, or for simple people, hashtag it's a gut feeling.
That's right. So you might have noticed that you have digestive problems, like we mentioned, a bunch of different stress responses, but you might get that immediate, like, oh, I gotta use the bathroom feeling, or a cramping sensation, or different,
Nausea or a feeling that's queasy. And what happens, and the neurons are connected with muscles. So the muscles in the digestive system are connected to the brain via the neurons and the chemicals that are going through. So they cause contraction of these muscles. So the tube inside them from the mouth to the anus contracts. And that can increase the contractility or slow it down. If it slows it down, you get constipated and you get bloated. If it increases, you get diarrhea and you get a runny nose and runny bowels, and you got to go to the bathroom. So this is a stress response where the colon and the digestive system says, uh-oh, we got to either slow down or hurry up. And either way, we got to get rid of this problem that's going around that we are feeling. And that is what the response of the digestive system is. And that can cause problems. And that's where we say, okay, I'm not feeling well. I have this problem and that problem.
And it's related to stress.
The stress that is going around.
I know, like, for example, a lot of our team members here on staff, they're in school studying for whatever further education they want in the medical field. And often they're pretty stressed out. So sometimes they're even getting these responses, you know, and we have to discuss the same topics with them because they're, you know, getting nervous before an exam, or they know that they have new classes coming up that they have to prepare for. So
I remember as a kid, you know, the butterflies in the stomach feeling when you're going into an exam room and you have not had breakfast. Bad idea, guys. If you're going anything, your digestive system needs to be adequately prepared for that.
right.
And do you know many things can happen if you have a stressful problem? I mean, like stress in your life.
Right,
It can
which
really
is
affect your digestive system.
gonna be what I was gonna ask next. So like, what kind of digestive issues might be caused by stress?
So most commonly, we've all heard of the word IBS, irritable bowel syndrome. It's basically says itself. The bowels get irritated, and then you get a syndrome.
Simple as that.
No.
Science.
Science. So the science behind the syndrome, which is basically label for problems that happen to your digestive system that can cause nausea, bloating, diarrhea, distension, abdominal pain, constipation. All of that in some patients is excessive than normal. And that excessive response has been found to be related to the stress in our life, along with other things like medicines, foods, environmental factors, genetic
No.
factors, etc.
I'm always getting these two confused. There's irritable bowel syndrome and there's irritable bowel disease.
Inflammatory bowel disease.
Inflammatory bowel. So don't be confused like me.
So there are two things. IBS is irritable bowel syndrome, which is problems in the digestive system, mostly due to stressful situations. And when they become inflamed and cause actual damage, we now know that there are two major classes. Inflammatory bowel disease is either Crohn's disease or ulcerative colitis, or it could be a combination of them. And
So
these are problems that are cause actual problems in the colon or small intestine or any other part of the GI tract. They cause ulcers, bleeding, injury, and problems that can actually manifest themselves. So they are actual pathology, actual stuff. With irritable bowel syndrome, you just have the symptoms, but no real, I should say, consequences of that.
yeah,
That can be seen.
we talked about this in a previous discussion here on the show. So that's why I wanted to reiterate again too, because it is a little bit confusing, especially if you're going by just the abbreviation, IBS, IBD, ABC, who knows?
XYZ.
But like he's saying, the irritable bowel syndrome isn't as definable. We're not able to pinpoint, is it based on stress? Is it based on your diet? Is it based on an allergy? Is it based on environmental factors?
But we do know that exacerbation of your cortisol and your adrenaline and the stressful responses make you have more symptoms.
Right.
So if you have IBS with diarrhea, you'll have more diarrhea. If you have IBS with constipation, you can get more constipated. So it can either slow down your intestines or make it faster.
And when IBS is being maybe treated or diagnosed with patients, they're looking at these factors. So one of the main factors they're considering is your nervous system,
And
your
your
stress
digestive
system. So in direct relation to your digestive system.
Correct. So digestive system and the nervous system should be work together, and we should call it the gut-brain axis, or something like that. So that's something which we are learning slowly.
But inflammatory bowel disease, like you said, has pathology. So we can actually pinpoint, diagnose, hopefully treat to some extent whatever's going on in that case. So it's a more definitive diagnosis, whereas IBS is a little more loose-ended.
Correct. The other things that can happen is in the upper gastrointestinal tract. So you get nausea, belching, heartburn-like symptoms. We call them GERD or gastroesophageal reflux. And that is a mechanical problem and a problem of chemicals that are abnormal. So mechanically, there's a valve that kind of opens when you eat food, and food goes only one way. So it goes down. So if your food is coming up, it's called reflux. And that reflux happens when the valves open up and things pop up. And sometimes when you have a stressful situation, which could be a chemical problem, if you take caffeine, nicotine, alcohol, or some other damaging stress to the lining, or if you're if you have a mental issue or like a psychological problem or a physical problem where it's a lot of heat or very cold or you get into trauma or something.
So that's a good point. You can be causing stress on the body from your mind, or it could be real factors like you say, like heat causes your body to overheat and overwork, and your systems
or for that matter. Or chemicals like you take something, or viruses or infections. So stress is a response of the body to any attack that happens to your body, and we fight that with chemicals and neurons and cells that go on.
So stress doesn't just mean like oh, I'm nervous about something, it could be exposing yourself to some environment or ingesting some, you know, chemical like alcohol or medication or something, yeah.
So gastroesophageal reflux also increases acidity in the stomach, which can also cause peptic ulcer disease. So peptic ulcer disease means that the hydrochloric acid in your stomach gets higher and higher in concentration, and that starts to cause damage to the lining, and other hormones and other chemicals also start to eat up the insides, and that becomes a problem. So your body then tries to get rid of all of the problems like that.
So does your stomach kind of like act like a hero? You're like, all right, you're stressing me out, I got the cure, and it starts reacting in some kind of way, or?
You know, you're so right. So say you eat meat, or you drink alcohol, which is a stressor. Okay, your body will think of that. Okay, I've got an abnormal chemical going through my body, so it'll make more acid to try to digest or try to neutralize the alcohol or the fats or the meat or the protein or any other pills or something else. So your body responds by increasing the secretions it can make. Secretions, the pancreatic secretions, the small intestine secretions, and sometimes the colonic secretions. And those try to get it out of your body. That's the whole purpose.
What about the just purely chemical reaction? What if it's a mental stress?
So a mental stress can affect you in many ways. Similarly, your body is going to release from the hypothalamic pituitary gland area, it will release agents like cortisol releasing factor. These are neurotransmitters that go to the next level in your kidneys and your thyroid gland and other adrenal glands and says, hey, pump up the volume, give me adrenaline, give me cortisol, give me acetylcholine or something else. And these chemicals then cause other chemical reactions. And those chemical reactions cause cascades of events. And that causes all kinds of problems.
It's interesting to me that the gut is a muscle.
Gut is not only a muscle, but is also a brain. And it's also a source of lymphatic tissue. Do you know that throughout the small intestine and some parts of the colon, there's a lot of lymphocytes and troops that are stored away for some emergency. So if you take a abnormal pathogen, or if you eat some, say you eat some old fish, or you eat some food that's gone bad, and you digest it, and then your body has these cells that will release. And these cells are mast cells and lymphocytes and other microscopic troops, and they go in battle. And they release antibodies and other chemicals to bombard the bacteria. The antibodies go and fight around them. A lot of things are happening simultaneously all the time.
And that might cause constipation or different reactions in the gut.
So that's what's going on. So then the bowel said, hold on, we got to slow it down to digest it, or we got to accelerate it to shove it out of you. So either way, your body's going to respond with the muscle that it has. So the muscle in the colon and the small intestine will either slow down or move faster. And then the secretory part will either secrete more or will absorb more. So that can also happen. And the cells inside can replicate or can do other things. Now, I'm slowly lining you up to the next part, the microbiome. When we talk about the cells, guys, we are lined with trillions of bacteria, trillions of other organisms, other cells that live off our gastrointestinal lining and off our food. They are called the microbiome or the gut bacteria. And dis-ease, which is not being at ease, means that your body is sick. That's when the bacteria inside the small intestine and the colon don't work together, and they are not giving enough stuff, and they may lead the bacteria to invade the lining or damage the lining in some way.
Now, we didn't discuss this prior to our discussion, but I remember reading within the last 5 years or so about the discovery of basically like another lining in our system. That's almost like a skin,
Yeah.
but it's around all of our organs and our internal workings.
So it's the bacteria that line the intestines, and these bacteria are there as a layer. And when we poop, we can regenerate that every few days. So these microbiome protects all of us. So that is very important. So dysbiosis, where the bacteria are ill, can cause you to get various diseases and diarrhea. So that's something that is going on where the microbiome and the neurons all work together with the muscles to improve the digestive health and immunity.
So there's got to be a way to kind of figure out what's going on with you, though. You got to be able to manage your stress, right?
Yeah, so there comes the treatment part. How do you manage the stress? How do you control all of this and improve your outcomes?
Which is easier said than done, typically. I think you're indicating maybe
Relaxation,
Okay.
meditation, taking a deep breath, making your body slow down, eating better food, exercise.
I was gonna say diet, exercise, especially we're talking about in relation to your colon health. So stress, you can reduce some of that more direct stress by what you're eating. You might be stressing your body by the things that you're consuming.
Absolutely. If you don't eat good food, you are causing a huge stress to your body. So add probiotics, add fiber. Always bring fiber up in every talk, guys. Fiber is so good for you. It feeds your bacteria. It gives you the energy that you require inside, and it will allow your body to heal. So food, very important.
Food is medicine.
Food is definitely medicine.
And like I said, you are what you eat. That's my motto. I like to stick with that.
And you know what else is very important? We talked about it last time, and the audience remembers.
What?
Sleep, guys. If you have good resting sleep and your body is relaxed, meaning your cortisol levels are low, your adrenaline is low, you are able to breathe better because you're sleeping better.
So there's a lot going on when you're sleeping. You think you're just out, but your body is doing a lot of different functions that it can't do during the day because you're giving it too many stresses and other factors.
That's when it's in the mechanic's shop. You know, when it's driving around the highway, the car is not getting fixed. When you put it in the shop and it's in the garage and getting lubricated and getting its tire fixed and pressure checked, that's when the car is in a better shape. So that when you drive it next day, you're like, Yahoo, I've got a brand new car.
Yahoo! Well, another thing I always mention to patients too, if I'm giving extra advice on dietary education and lifestyle habits, is using your family and friends for support too. Because like I said, these are things easier said than done. We're like, yeah, manage your stress, have good mental health, have a good diet, sleep more. But these aren't things that are easy to do solo. You kind of need someone to make sure that you do it right.
And that's where stress and social environment comes in. So having people around you to discuss, having friends, having family, having a coping mechanism, so important.
Yeah,
and
you mentioned like relaxation, exercise. Those are things you can do individually, but sometimes you need a partner. Maybe you can't get out of bed early in the morning. You need that partner to say, hey, get up, come exercise with me, come take a walk. Or, hey, you're not eating the right things. We shouldn't be eating that after work just because we're hungry and want a quick fix.
Let's go work out or do something else. Or let's go to sleep together so that we don't stay up too late. Or let's watch a movie, or let's go listen to some good music.
Yeah.
Or those are all things that will improve your body and your mind and your relationship with everybody around you.
Yeah, so your maybe your IBS might improve because you're doing the right social factors for yourself.
So social factors also mean that you can do behavioral therapy, you can do meditative exercises. You can do yoga, you can do running, you can go swimming, you can sleep, you can rest, you can just sit down and take a break and have a Kit Kat.
Oh,
And-
Kit Kat. That's not
and-
good for you.
Just taking it as an example. I'm sure the Kit Kat people are going to come after me. But relaxation is very important, guys. We don't have a lot of time, but I wanted to go over one relaxation technique,
Is there a lot?
guys. Part of our body is these lungs that we got. If we inhale and exhale, inhale and exhale, inhale and exhale 3 times in a slow, dependent manner. Whether you have an iPhone watch or some other watch to help you, or you just do it on your own.
And you can set the mood. I mean, like, for example, this beautiful scenery we have behind us. This is our space for doing some yoga in the office when we want. We need that, like, little touch of sunshine in nature. So, whatever you can do to,
Smell the roses.
yeah.
You know, go outside and hear the birds sing, like Sydney mentioned last time.
I wasn't going to say it, but I was thinking it.
I was thinking about it too. So sleep is very important, okay? Decreasing anxiety and stress will have a very positive outcome on your colon, because you're not going to have the gurgling. You may not have the diarrhea. You may not be bloated and constipated.
And something I tell our patients too when talking about these things is remember that everything is habitual. So if you start good habits for yourself, if you're staying hydrated every day on water instead of Coca-Cola, or you're getting that sleep, you don't go to bed past 10 o'clock at night. That's your standard.
Hydration also, guys, very important. We are all cucumbers. Drink lots of water.
Yeah, so if you establish good habits for yourself, your sleep is on schedule every day, your diet is strict, you don't curve away from it, or you do in very small moderation. So developing these good habits is going to tenfold reduce your stress, and it's on the physiological level and the mental level as well.
Correct, guys. It'll make a big difference in your digestive health, your colonic health. You will feel better. And what that will do is that it will decrease inflammation in the colon. So it may not be easy to prove, but we have suspicion that stress plays a big role in colorectal cancer, in inflammatory bowel disease, in irritable bowel syndrome and other problems like that, in gastrointestinal diseases like ulceration and reflux problems, pancreatitis, all these things where there's inflammation.
In fact, even mental health disorders too, they're finding are more and more related to inflammatory responses.
Correct. So
So-
if you have a neurologic brain injury, you will get an ulcer in the stomach because the cortisol level goes up. So you can improve that with medications, or you can improve that by decreasing the stress in your life. With medications or without, there's debate about that, but you can have many tools for that.
Right. And there's plant-based options, there's pharmaceutical options, and there's just good old relaxation and stress management too.
Yes,
So,
that's amazing stuff, guys. So look into all of that. We'll be back again next week with another interesting topic.
yes.
This is the DaBootyDoc Talk with Shiraz Farooq and Sydney Farooq. We are here at Colwell America in Tampa, Florida.
We survived the thunderstorm, so
I'm hoping
not
that
feeling as
this,
stressed out anymore.
you know what, I'm still wondering if this show went through.
No, I think it did. I think
It
it worked
did,
out.
did?
You guys let us know. Give us a thumbs
I'm
up
not
down
stressed about
there.
it.
Not
No.
stressed about it at all.
Laughter is the best medicine.
That's right.
So please laugh. It's all funny, okay?
It's all fun and games, right?
Yeah. So make fun of yourself and enjoy this life, because you only get one chance at it. So have fun with it. Sleep well, eat well, rest well, and call well.
Well, thank you for joining us. Hope you guys enjoyed the topic today. Leave us some suggestions or questions in the comments if you'd like. We'll be posting our next topic for next week. So if you want to hear about something in particular, or maybe if you want to feature a particular question, let us know. We're happy to help. That's what we're here for.
Thank you guys. The DaBootyDoc Talk signing off. Very happy to be here. Thank you very much.
Have a good evening, everyone.